Okay, so hello everyone. Today the topic we are going to discuss is the blood supply of eye in a quite superficial manner, and mainstream blood supply of eye itself. The blood supply of conjunctiva and lids I'll see separately. Also the optic nerve. So blood supply of eye, all the arteries that we will be dealing are mainly the branches of internal carotid artery. Now main branch that we have to deal is the ophthalmic artery. The branches from ophthalmic artery are the main supplying the eyeball. Ophthalmic artery is originated from ICA at the anterior clinoid process of the sphenoid bone. So you see exactly somewhere here the anterior clinoid process it is. From here the ICA will give branch, and it is the first branch in the skull, which is ophthalmic artery. Now straightforward here we will be dealing with the three main branches regarding supply of the eye. First is the central retinal artery. Second is the muscular branches of the ophthalmic artery and the posterior ciliary arteries, as there are multiple branches of the same. So this is how it comes, as from here anterior clinoid process this divides, and there is actually a course till where there is ophthalmic artery. After that it divides into branches. This is the medial part here, this is the lateral part. Here are the ethmoidal sinuses. So laterally it gives a branch which is lacrimal artery, which will go ahead anteriorly, and anteriorly it will give branches as a medial and lateral palpebral artery supplying the lids. But here we won't be discussing much in depth about that. Here laterally this thing, medially it gives the branch of muscular arteries. Muscular arteries will give few more branches for supplying of the ethmoidal sinus, and so here it gives the branch of central retinal artery at this place. Here it gives short posterior ciliary artery, long posterior ciliary artery. Okay, so to understand from uh, so this is how both muscular arteries will come, like this, and they come vertically, so they will be supplying. So there are two muscular arteries, one is medial, two medial and two lateral. So they come like this, but they have one branch which is the AC anterior ciliary artery, which will be supplying vertically. So we'll see two medial and two lateral arteries. Medial will supply MR, IR and IO. Two lateral branches will supply LR, LPS, SR and SO. They will give one branch which is anterior ciliary artery. Anterior ciliary artery gives two branch to each muscles except lateral rectus. So total 7 branch. 2 to medial rectus, 2 to superior, 2 to inferior rectus, 1 to lateral rectus, which so two muscular branches, two medial and two lateral. Medial ones will supply medial rectus, inferior oblique. Two lateral will give supply to lateral rectus, LPS, SR and SO. They both will end up giving one branch which is anterior ciliary artery. This gives two branches to MR, SR, IR and one only branch to lateral rectus. So total 7 branch. This is the reason for causing anterior segment ischemia in strabismus surgery. So if we see in this way, the two muscular branches will end up coming horizontally, supplying on the globe, while the main branches from ACA, they come vertically like this in the gross anatomy. So that is why vertical rectus surgery has more preponderance towards the intersegment ischemia, and they say that we should do at least one vertical rectus surgery at a time rather disturbing two muscles. So to remember this, you can do like this, that is how the globe is. And here this is the medial, this is the lateral part. So medial muscular branch comes, and it supplies from here medial rectus to inferior oblique to inferior rectus, and in case if lateral branch comes from here, lateral rectus, superior oblique, superior rectus and LPS, like this. Now CRA, the central retinal artery, this will be traveling along with optic nerve. So this is the optic nerve. Over it travels, and it gives off many small branches which are the pial branches. They form the pial plexus. They supply a part of the optic nerve also, and optic nerve head also as a pial plexus. Now this enters the globe along with optic nerve, and it divides into the arcades which are superior, temporal, inferior temporal, superior inferior nasal arcades. Now this will supply inner 6 layers of the whole retina except this macular area, except the macular area, because this will be supplied by choriocapillaries. Then coming to third part, which is posterior ciliary arteries, there are mainly two, long and short. Two long posterior ciliary arteries will be there, two LPCAs. Now they will invade the globe laterally, and around 20 short posterior ciliary arteries are there. How LPCA will travel is, it will travel in the suprachoroidal lamina of the choroid layer, which is between the choroid and sclera. In the suprachoroidal lamina, it will travel till the ciliary body. Here in the ciliary body, it will give blood supply from along in the ciliary body itself. Along with anterior ciliary artery, it will make major arterial circle of iris, which is here. This is the major arterial circle of iris, which again continues as the radial branches over the iris and forms minor arterial circle of iris. So this comes straight forward in the suprachoroidal lamella till ciliary body, supplying the ciliary body and then making major and minor arterial circle of iris. Now SPCA, it gives around 20 small branches at the optic nerve. Now they will form a plexus circle at the optic nerve known as circle of Zinholler. So this also supplies the retrolamellar and lamellar part of the optic nerve head. Now this is how is the blood supply. If you see in the globe, main part after it invades into choroid. Now majority part of the choroid is supplied by SPCA like this. This much part is supplied by LPCA, ciliary body and iris. Sometimes the SPCA might give one aberrant branch, rarely, which is known as cilioretinal artery. Now this also enters the globe, and this in such cases supplies macular area. So when patients who have aberrant cilioretinal artery, it will look like this in between, and in this patients, if CRAO happens, they will be still retaining the vision, as this is supplied by the SPCA aberrant branch cilioretinal artery rather than the CRA. So here vision will be preserved. So that's all. Let me know for any suggestions regarding the same. Thank you.